Here we go again. Part A is the hospital indemnity. It's financed through a portion of payroll tax or FICA FICA. Part B, medical insurance, is financed from monthly premiums paid by the insureds and from general revenues of the federal government. Part C is the Medicare Advantage. Now this is a good one. Allows people to receive their health care services through available provider organizations. And Part D is prescription drugs for any prescription drug coverage. However, that the term original Medicare refers to Part A, hospital insurance, and Part B, medical insurance only. It covers health care from any doctor, health care provider, hospital, or facility that accepts Medicare patients. It usually does not cover prescription drugs. Original Medicare does not require patient to choose a primary care doctor, nor does it require a referral to see a specialist, as long as the specialist is enrolled in Medicare. Know this: Part A, hospital indemnity, and Part B is medical insurance. The following claims, terminology, and other key terms applicable to Medicare: the actual charge, the amount the physician or supplier actually bills for a particular service or supply, ambulatory surgical services, care that is provided in an ambulatory center. These are surgical services performed at a center and do not require hospital stay, unlike inpatient hospital surgery. Approved amount, the amount the Medicare it determines to be reasonable for the service and is covered under Part B of Medicare. Assignment, the physician or the medical provider or supplier agrees to accept the Medicare approved amount and is or a full payment and agrees to accept for the covered services. Carriers, their organizations and processes claims that are supplemented by doctors and suppliers of Medicare. Co-insurance, a portion of Medicare approved amount that the beneficiary is responsible for paying. Comprehensive outpatient rehab facility services. That's a long one. Outpatient services received from Medicare participating comprehensive outpatient rehab facility. Deductible, the amount of expense of a beneficiary must pay, first incur before the services are provided. Covered services are provided. Durable medical equipment, DME. Medical equipment such as oxygen equipment, wheelchairs, and other medical necessary equipment that the doctor purchases for use in the home. Excess charge. The difference between the Medicare approved amount for a service or supply and the actual charge. Intermediaries, organizations that processes inpatient and outpatient claims on individuals or hospitals, skilled nursing facilities, home health agencies, hospice, and certain other providers of health services. Limiting charge. The maximum amount the physician may charge a Medicare beneficiary or a covered service if the physician does not accept the assignment. Now we go into Medigap. Medigap policies cannot include a provision that restricts coverage for pre-existing conditions for more than 6 months. In addition, if the insured has had a Medigap policy for at least 6 months and decides to change to another policy, the new policy cannot have a waiting period for the pre-existing condition for the same coverage that was included in the old policy. If the replacement policy includes additional coverage that was not in the old policy, then the 6-month waiting period can be applied, but only if as it pertains to additional coverage. Medicaid. Medicaid aid, remember, is a federal and state funded program for those whose income and resources are insufficient to meet the cost of necessary medical care. Individual states design and administer the Medicaid program, typically through the state's Department of Public Welfare, under a broad guidelines established by the federal government. To qualify for Medicaid, individuals must meet income and other eligibility requirements. Once the person is determined to qualify with low income and low assets, the person must meet their qualifiers, some of which are blindness, disability, pregnancy, or age of 65, over 65, or caring for children receiving welfare benefits. For many eligible for many eligibility groups, incomes is calculated in relation to percentage of federal poverty level, FPL. After the implementation of the Affordable Care Act, new modernized rules regarding verification of Medicaid eligibility will mean that the state Medicaid agencies will rely primarily on information available through data resources such as Social Security Administration, the Departments of Homeland Security, and Labor, rather than paper documentation from families. Each state has prepared a verification plan for Medicaid or other to comply with the new rules. In addition to certain levels of income and assets, there are other non-financial eligibility criteria that are used to determine Medicaid eligibility. In order to be eligible for Medicaid, individuals need to satisfy federal state requirements regarding residency, immigration status, and documentation of U.S. citizenship. Medicaid mandates that the states provide at least the following: a physical, patient hospital care, outpatient hospital care, skilled nursing home services, laboratory and x-ray services, home health care services, rural health care services, periodic screening, diagnosis, and treatment, family planning services, and Medicaid also pays for prescription drugs, dental services, private duty services, nursing services, eyeglasses, checkups, and medical supplies and equipment. They aid a lot. Social Security provides disability income benefits to those who qualify. These benefits are also referred to old age survivors and disability insurance, OASDI. The individual must have the proper insured status, meet the definition of disability, and satisfy the wait period. It is difficult to qualify for disability income benefits under Social Security because of the strict definition of total disability that must be met. A person who apply for disability for Social Security disability benefits are referred to state agencies called Disability Determination Services, DDS, to evaluate the disability If the state agency is satisfied that the worker is disabled and defined by Social Security Act, the individual is certified as such, the benefits are paid after long waiting period has been satisfied. Definition of disability. In order to be considered as total disabled under Social Security, one's disability has to meet the following definition: the inability to engage in a gainful work that exists in the national economy. The disability must result in medically determined physical or mental impairment that is expected to result in early death or is expected to last for continuous 12 months. To qualify for disability benefits under Social Security, the disabled person must have earned a certain amount of credits. A maximum of 4 work credits can be earned each year. Generally, an individual needs 40 credits, 20 of which have been earned in the last 10 years before the disability. In other circumstances, the amount of required credits varies by age. Before age 24, persons can qualify for benefits with only 6 credits earned in 3 years prior to start of disability. Ages 24 to 31, persons can qualify for benefits if they have credit having worked half of time between the ages 21 and the start of disability. For example, if Joe becomes disabled at 27, he would have earned 12 for 3 years worth of the prior 6 years between the ages 21 to 27. After the age 31, the number of work credits required varies even more, but at least 20 of those credits must have been earned in the 10 years immediately prior to becoming disabled. The following table applies to those born after 1929. Assuming a person meets these stringent requirements, he or she will have to wait 5 months waiting period under Social Security before any benefits will be paid. Actual benefit payments start with the 6th month of disability. The amount of Social Security disability benefit will be based on the person's primary insurance PIA, primary insurance amount. The PIA is based on the person's average index earnings on which Social Security taxes have been paid, while higher average earnings is resulted in a larger absolute benefit. Lower paid workers, other thing being equal, will receive a greater percentage of their disability income than higher paid workers. It is estimated by Social Security Administration that a disabled employee who has been earning a minimum wage can expect a Social Security benefit of approximately 57% of earnings at the time of disability. An employee who has been paying the maximum Social Security tax can expect a benefit of only about 30% of pre-disability earnings that were subject to Social Security taxation. Social Security benefits cease on the individual's retirement benefits start when the individual dies or is no longer disabled. At death, the family benefit will continue as your survivor benefits. Benefits will continue for an adjusted period of 3 months if the individual is no longer satisfied the definition of disability. Goodness. In this scenario, 30 by 10 benefit pre-disability earnings. 30 by 10 benefit 25,000. Therefore, benefit 30 times 25,000 by 100 or 7,500. They don't pay you shit. In other words, recap. In this chapter, explain health insurance availability to senior citizens and special need individuals, Medicare, Medicaid supplements, Medicare supplements, Medicaid, and Social Security disability. Let's recap some key points. Basics. For Medicare, Medicare is a federal medical expense insurance program for people who are the age of 65 or older or have been entitled to Social Security disability income benefits for 2 years or have permanent kidney failure. 4 parts. There's 4 parts of Medicare. Part A is hospital insurance, financed through payroll tax or FICA. Part B is medical insurance, financed through insurers or general revenues. Part C is Medicare Advantage, allows for receipt of healthcare services throughout available provider organizations. And Part D is prescription drug coverage. Going back to Part A under Medicare, individual enrollment period. When an individual first becomes eligible for Medicare, starting 3 months before the age of 65, ending 3 months after their 65th birthday. General enrollment period is between January 1st and March 31st each year. Special enrollment for any time during the year if the individual, his or her spouse, is still employed and covered under a group health plan. The coverage would be inpatient hospital care, skilled nursing facility, health care, home health care, hospital. Hospice Part B is optional, covered to anyone who enrolls in Part A. With Part B, you have doctor services, outpatient hospital services, health visits, other medical and health services, prescription drugs, limited coverage, outpatient treatment of mental illness, and yearly wellness visit. Part C, Medicare Advantage, requires enrollment in Part A and B. Okay. Provided by approved medical or health maintenance organization or preferred provider organization. Now, Part D is prescription drug. Optional coverage through private prescription plans that contract with Medicare, primary and secondary payer, for individuals eligible for Medicare coverage who continue to work. The employer's health plan would be the primary coverage, while Medicare would be the secondary. Now, the basics with Medicare: the preferred Medicare supplement plans. The preferred is Medigap. Policies issued by private insurance companies to fill gaps in Medicare. Now, the coverage in Medigap. Plan A is core benefits such as co-insurance, co-pay, and additional Part A hospital costs, hospital care, co-insurance, co-pay. Part B, co-insurance, co-pay, 3 pints of blood under Part A and B, Plan B through N. Core benefits, various additional benefits. Okay, Medigap is tedious. The purpose for Medicaid is medical care for those income and resources are insufficient. They're federal and state funded. That's Medicaid aid. Social Security benefits, the basics: OSADI, Old Age, Survivor, and Disability Insurance. That's Social Security. Provides disability income benefits. Individual must meet prior insurer status. Definition of disability and wait period requirements. Qualifying for disability benefits, individual must earn 40 work credits for each year, 20 of which were earned in the 10 years before the disability. A 5-month wait period. Benefits are based on PIA. Now we get into underwriting. Underwriting is really tedious. There's a whole bunch of little stuff. Field underwriting procedures. In this section, you will take a look at the producer's first major role in transacting insurance, completing the application, and delivering the policy. You will review the specific steps of the application process, which includes completing the form itself, collecting the premium, and delivering the policy. This section also discusses the characteristics and requirements of contracts and in general. Some of the unique aspects of health insurance contracts. This section will help you build the foundation of health insurance concepts and are important not only for your licensing exam, but also for your role as an insurance provider. So, definitions. Agent, or producer, a legal representation of insurance company. The classification of producer usually includes agents and brokers. Agents are agents of the insurer. Applicant, or proposed insured, a person applying for insurance. Consent, the permission to do something. Insurable interest, the policy owner facing the responsibility of losing something of value in the event of loss. Insurance policy, a contract between a policy owner and or insured and an insurance company, which agrees to pay the insured or beneficiary for the loss caused by specific events. Insured, the person covered by the insurance policy, may or may not be the policy owner. Policy owner, the person entitled to exercise the rights and privileges of the policy. Premium, the money paid to the insurance company for the insurance policy. Completing application and obtaining necessary signatures. Okay. An application for insurance begins with a form provided by the company and completed by the agent as questions are asked of the applicant, and the applicant's responses are recorded. This form, often called the app, is then submitted to the insurance company for its approval or rejection. The application is the applicant's written request to the insurance company to issue a policy or contract based upon the information contained on the application. If the policy is issued, a copy of the application is stapled to the back of the policy, and it becomes part of the entire contract. A notice to the applicant must be issued to all applicants for health insurance coverage. This notice informs the applicant that credit report will be ordered concerning their past history of any other health insurance for which the applicant has previously applied. The agent must leave this notice with the applicant. The agent must take special care in the accuracy of the application and the insurance of both the company and insured. Because the application is often the main source of underwriting information, it is the agent's responsibility to make certain that the application is filled out completely, correctly, and to the best of the applicant's knowledge. Know this: it is the agent's responsibility to make sure the application for the insurance is complete and accurate to the best knowledge of the applicant. Signature. Every health insurance application requires the signature of the proposed insurance, the policy owner, if different than the insured, and agent who solicits the insurance. Changes on the application. Because the application is so important, most companies require that it be filled out in ink. The agent might make a mistake when filling out the app, or application might answer a question incorrectly and want to change it. There are two ways to correct the application. The first and best is to simply start over with a fresh application. If that is not practical, draw a line through the incorrect answer and insert the correct one. The applicant must initial the correct answer. Know this: any changes on the application must be initialed by the applicant or insured. Premiums with the application. Generally, an initial premium is collected for a health insurance policy and sent to the insurer with the application. A conditional receipt is received to the application by the agent. However, the agent cannot bind the coverage, so the coverage does not begin until the insurer the insurer has approved the application and issued the policy. Initial premium application. In cases where premium did not accompany the application for the insurance upon delivery, the agent must collect the premium to obtain a statement to continue good health, of continuing good health from the applicant before releasing the policy. Submitting application to the company for underwriting. The agent is obligated to check the application, make certain that all questions have been answered and all necessary signatures have been collected. The agent then sends the application to the insurer. In order to determine insurability of the applicant, the insurer may use several sources such as Medical Information Bureau, MIB, report for gathering underwriting information. The applicant must be advised of the sources to be used and how the information is gathered. All sources used to verify insurability must adhere to the Fair Credit Report Act. 1. Attending physician report. If an underwriter determines it is necessary, an attending physician statement, APS, will be sent to the applicant's doctor to be completed. This source of information is the best for accurate information on the applicant's medical history. The physician can explain exactly what the applicant was treated for, the treatment required, the length of treatment and recovery, and the diagnosis. 2. Medical exam report. Medical examinations, when required by the insurance company, are conducted by physicians or paramedics at the insurance company's expense. Usually, such exams are not required with regard to health insurance, thus stressing the importance of the agent in recording medical information on the application. The medical exam requirements is more common than life insurance underwriting. If an insurer requests a medical examination, the insurer is responsible for the cost of the exam. If the insurer requires an applicant to take an HIV test, the insurer must obtain the applicant's written consent for the test. The consent form must explain the purpose of the test, the form of the applicant, and inform the applicant about the confidentiality of the results and procedures for notifying the applicant about the results. Underwriting for HIV or AIDS is permitted as long as it is not unfairly discriminatory and adverse symptoms, but only is HIV is confirmed if HIV is confirmed in relation to the symptoms. Insurance companies must maintain strict confidentiality regarding HIV-related test results or diagnosis. HIPAA privacy. Under the privacy rule for HIPAA, Health Insurance Portability and Accountability Act, protecting information includes all identifiable health information held or transmitted by a covered entity or its business associates in any form or media, whether electronic, paper, or oral. It is called Protected Health Information, PHI. Individual identifiable health information require including demographic data that relates to past, present, or future physical or mental health or condition, or payment information that could easily identify the individual. Covered entity must obtain the individual written authorization to diagnose information that is not for treatment, payment, or health operations.